Okay, speaking introduction, occupational English test. Okay, we will start. Okay, you will
Hello?
have 3 minutes. Yes,
Yeah, continue.
you have 3 minutes to start occupational English test. Okay, this called warm-up session. Okay,
Okay.
warm-up session. Okay, I will ask you now. Hello, how can I address you?
Hello? Hi.
Yes.
Uh,
What's your name?
so, my name is Nidhi Sharma.
Welcome, Mrs. Nidhi. What's your profession?
I'm doctor.
And for how long have you been working as a doctor?
I've been working for past more than 5 years, 5 to 6 years.
Perfect. And why you are taking the occupational English test exam?
Actually, I'm taking the OET exam to complete the GMC process.
Perfect. And I will return back to your profession. Why did you choose medicine as a career?
I've chosen medicine as a career because of a lot of reasons. First of all, it is a very respectful job and it gives you the chance to help people. From the economy view, it earns good money.
Perfect. And what's about your specialty?
I'm a surgeon, and then initially I had big conflict. It was a big conflict for me to decide regarding a specialty because I like all parts of medicine, but I was hesitating to choose just one specialty and leave the others, and so I went for surgery.
Okay, perfect. Now we have finished our 3 minutes warm-up session. And
Okay.
for your knowledge, this will not be assessed, okay? Because once I press the record, our session will start, okay?
Okay.
Okay. This is the first 3 minutes, okay?
Okay.
What is the components of a speaking role play and what is the template? Okay, we have introduction, we have
Okay.
show sympathy and take
Okay.
history. Okay, we have to start taking history, clarify, and end of the history. Finally, we have to tell the patient our diagnosis. Okay.
Mm-hmm.
Lastly, the management. Okay.
Okay.
After management, we will reassure and we will face a reluctant patient.
Okay.
Okay. I will check the understanding of this patient. Okay. I will do signposting and I will summarize, and we have some special cases. Okay. How to start? I will say, according to the introduction, you will ask yourself, is this the first visit or a follow-up second visit? Okay, because you cannot ask a patient about his name and he follows himself up with you. Okay, so you will ask about name in case of the first visit, or the interlocutor will not tell you about this. You will discover this in the card, and we will see this later. Okay.
Okay.
You will tell him, good afternoon. My name is Dr. Nidhi. I'm the treating doctor for today. How can I help you?
Okay.
But in the first follow-up visit, And here you will ask him about name. You will tell him, how can I address you? May I address you, sir? He will tell you the name. Okay. In a follow-up visit, you will tell him, good afternoon. Nice to meet you again. How are you so far? Oh, it's been a while. Okay. Whatever.
Yeah.
How can I help you today? Or how can I help you? Okay.
Okay.
He actually will tell you the complaint exactly like the card. Okay. But you will never speak like the card. You have to paraphrase. You have to take the sentences, words, and paraphrase them. Okay. Don't tell the same words in the card. You have to find synonyms. Is that okay?
Yeah.
Okay. We will start. He will tell the complaint, and you have to start with the following: sympathy, then information bullet, then reassurance. Okay. So, oh, I'm really sorry to hear that. Or, must be very painful for you. Must be stressful for you. Must have been stressful for you. But can I ask you some question first? If you never mind, or if you don't mind, you have to show the intonation to raise the voice and lower the voice. You cannot do that. I'm really sorry to hear that. It must be been very painful for you. You will lose marks because the intonation is important to clarify the sympathy with your body language. But body language, this is a record, so your body language will not be displayed in the record. This is not a TV, okay?
Mm-hmm.
So you have to show by intonation of your sound and your voice to be louder and like, I'm really sorry to hear that. It must be very painful for you. But can I ask you some question regarding your complaint?
Okay.
Okay. All right, mister. I appreciate your fears. I appreciate your concerns. I appreciate your words. Would you mind if I ask you a few further questions regarding this situation or this complaint? Okay. He will tell you, okay, sir, here you are. You will, okay. What about your appetite? Are you eating well?
Okay.
Have you had symptoms like you will tell him associated symptoms, and you know this as a doctor, so it will not be a problem. Okay, the associated symptoms. Could you describe this pain, the side, the duration? Is it decreasing? Is it increasing? Or all these are symptoms? Okay.
Okay.
Does anything special make it worse or relieve it? Secretes, secretes, site, onset, course, radiation, associated symptoms, and severity. How does it affect your daily routine? All of this about pain. Okay, site,
Yeah.
rates,
Yeah.
all of this.
Yeah.
And at the end of the history, you will ask him about, have you visited your GP for this condition? Have you tried any medication for it? It is there anything else that is bothering you? Or is there anything else that you suffer from? Whatever you will pronunciate, it will not be assessed. Your pronunciation, your intonation, your body language, all of this will be perfect impression for the interlocutor. Okay, and well, you will ask him, "Can I examine you?" You will simulate and not real examination. He will tell you, "Okay, well, based on your symptoms and upon examination, I believe that you have what's called gastroenteritis." Whatever. Here, the example is open for you. Okay,
Okay.
and let me explain you this condition. Okay, Have you ever heard about this? Have you heard of that? Okay, or you will tell him the finding of the investigation. Is it clear, Nidhi?
Yeah, it's
Yeah. The X-ray actually, or fortunately or unfortunately, the X-ray indicates that you have blah blah blah. The test results show that it's probably you have got a condition known as, and let me explain this condition. You have to tell him in layman
language.
language. Yeah.
Yeah.
Yeah. You can choose all of this. It is a condition caused by an example. The symptoms include.
What if we don't know about the condition?
Sorry?
I mean, like, suppose there is a disease, we don't know anything about it.
Your voice, Nidhi, is not clear now.
Hello, is it clear now?
Yeah.
Yeah. So I was saying, what if there is a disease and if we don't know much about the disease, so is it given? Is it there on the card?
No, it will not be given in the card. You have to increase the dose because you are a doctor. Don't worry. He will not talk about hypnosis. He will not talk about strange disease.
Okay.
Don't worry. I trust that you are perfect and you will get this. Okay.
Okay. Yeah.
Management. I think we should start with. We could to start with. I will give you a prescription for whatever. It will be like this. First of all, it's important. It's a good idea. It's whatever. What do you think? You can do it? Do you think you can do it? Is it easy to do it? Is it easy for you? Is it accessible for you? All of this.
Okay.
There are some very effective strategies to cope up with this or to cope with this. I would like to explain them for you. Is it okay with you?
Okay.
Be careful. You have to speak the following, okay? 3 sentences. Not elongate your sentences. Don't make the conversation boring like I'm doing now. Okay? Try to tell the patient, assess the understanding of the patient. Like, are you following me? Is that clear so far?
Are you with me?
Are you here? Do you hear me? Am I clear? Am I obvious for you? Is that obvious for you? Whatever, you can change this during your speaking to assess the understanding and the patient are following you. He might sleep because of the boring conversation. Okay.
Okay.
And it's a good idea, or it's time to start, or it's a good time to start. In terms of prescription, it will be necessary for you to do whatever. Okay? You have to reassure the patient. Let me reassure you that this disease is self-limiting. Or don't worry.
Hello?
Follow. Yeah, Nidhi?
Yeah.
Yeah. Don't
No,
worry.
continue.
Yeah. Don't worry. If you can follow my advice, you will get much better soon. Don't worry. It will go away by itself. I know it sounds difficult at first, but with practice, I'm sure you will be able to do whatever you want to tell him. I'm sure you won't have any more trouble. The staff are very experienced and will take good care of you.
Okay.
Yeah, you are in good hands. You have to reassure the patient, right?
Okay.
You have to show sympathy each time. Oh, I'm really sorry. And I really appreciate your fears. Yes, I feel that. It will be a burden for you. Yeah. You have to know this is a patient and you are a doctor. Don't tell the patient that, no, I'm a doctor and you have to follow me. No.
Yeah.
Try to understand that this is a patient and you are the doctor, not vice versa. Okay?
Yeah.
A reluctant patient. Okay? You will tell him, I really appreciate your concern. I can understand your words because you should meet a reluctant patient. So this in occupational English test language will be assessed how you will deal with this. Okay. You will never tell him, no. Follow me, please follow me. Stop and follow me. No, this is not the way the occupational English test examiners and interlocutors and they want you to be easy doctor, to be skilled doctor in dealing with such situation. So you have to, no doctor, I will not take these medications. You will tell him, I really appreciate your concerns. I can understand your fears, your worries. I do know how you feel, but let me explain some points for you. Give me more space. Okay, try to be the leader. You are the doctor. If the patient is still speaking, don't interrupt him, but try to be skilled and tell him, please, give me more space to speak with you, to reassure you, because you know all of the information, okay, but something missing, okay. I will clarify. Okay, so give me some space to speak with you and reassure you. I completely understand your busy time, whatever. I think you should find some time. What's more important, the risk of blah, blah, blah. Okay? Let
Mm-hmm.
me assure you, if you follow my instruction, my advice, all of this,
Okay.
let me explain to you why the insulin therapy is necessary or why these antibiotics are necessary for you. Okay, of course, you will need to continue. However, you can complicate if conditions and you have to show your language ability by mentioning if, however, thus, additionally, fortunately, uh, which, who, all of this will strengthen your level in English language. Okay.
Okay.
Okay, I understand, but let me explain to you why it is not good choice for you to do whatever. Finally, after agreeing, I am pleased to do that. Now,
Hello?
close. Okay, hello.
Yeah.
Check the voice is repeated. Please close the recording. Okay,
Yeah. Yeah, I think that's better.
check the understanding. Is that clear so far? Do you think you can do that? Do you? By the way, I'm recording the lectures for you, and I will give you the link. Don't worry.
Okay.
Okay, no problem, Nidhi.
Okay, thank you.
Thank you. Do you have any questions so far?
No, thank you.
It is for the patient, Nidhi.
Yeah, yeah, that's really thank you.
Signposting. First of all, the voice is repeated, Nidhi, again. Please, I will give you the recording. Don't worry, believe me.
No, I'm not doing anything. I'm not recording. I mean, I'm not. Hello?
But 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 the voice is repeated. I am listening. I'm hearing myself.
But why? Hello? Hello?
Yeah, yeah.
Yeah. Yeah. Now,
Okay,
now is it okay?
Okay. First of all, as I said before, as I told you earlier, I'm concerned about your smoking habit. It's important to stop. Okay, I have to highlight, to emphasize the importance of it is very beneficial for you. I recommend that. I strongly advise you to do whatever. Okay.
Okay.
For this reason, therefore, like we said, in addition, I'll say now that's a good question. Let me explain to you that it's a good idea to do whatever. Ending, do you have any more questions? Hope you feel better soon. I will see you in a couple of weeks. Wish you a speed recovery. I would like to see you in a week. I'd like to see you in a week. Don't hesitate to call me if you have any concerns. Thank you.
That's perfect.
Okay. So, special circumstances will be next. Okay. On the next lecture. Okay. I will start with you taking this.
Okay.
Okay. You are the carer.
Okay.
And okay, this is regarding, I think, Panadyne thrombosis. Okay, this is a carer, and I'm a doctor. What do you want exactly? Do you want the rule of the patient or the rule of the doctor? Okay, you will decide.
I think no. First, you be the doctor.
Okay, first I will be the doctor, then you will be. Okay,
Yes. Okay.
Nedhi. We have 3 minutes to read this. You and me. I have a stopwatch. I will adjust time
Okay.
to finish reading. I will tell you now. I will cut this. I will give you this only. I will take this only. I'm a doctor and you are the patient or the carer. Okay?
Okay. Yeah.
You will have this and I will have this. You will not take both of them. This will be cut in the exam. Okay?
But in the exam, we'll always get doctor card, right?
Sorry?
I mean, in the exam, we have to play the doctor role, right?
Sure, yeah. Sure.
Okay.
Because this is occupational English test medicine, not patient.
Yeah. Okay.
Okay, Nidhi. Now 3 minutes started. Are you ready?
Yeah, I'm ready. Hello.
Yeah,
So,
you
so
are
you
ready.
will begin or I'll begin?
I will begin. I'm the doctor. You choose to be the carer, okay? Okay.
Okay.
Good afternoon. I'm Dr. Rida Harbi, one of the treating doctors for today. How can I address you?
Hi, I'm Harry. I'm son of Harry Smith. Um,
Welcome.
which,
Nice to meet you. And how can I help you today?
um, as you know, my father, he had a history of atrial fibrillation for which he was prescribed Panadol. So my sister, she gave him a couple of her own Panadol tablets just to relieve some pain. But so I came here to so that he can prescribe medications for him.
Oh, I'm really sorry to hear that. It must be very painful for him. I really appreciate that Mr. Harry Smith has fallen at home. I'm really sorry to hear that. But can I ask you some question regarding uh, your father's state?
Yes, you can.
Yeah. Uh, for how long uh, has he fallen?
Um, he fell at home 2 days ago. It was
Yeah.
yeah, 2 days back, and then followed by he was having extensive bruising over on his right thigh.
Oh, I really appreciate that. And uh, I want to tell you something, Mrs., that I cannot prescribe any patient without a consultation, and this consultation should include the following: history and examination, and consent from the patient himself. So, uh, is that clear for you?
Yes, that's clear for me. No, but he's a lot of pain. So what should I do for that?
Okay. Um, I really appreciate that, but let me to explain some standards of care that it is very vital and it is necessary for the patient to be assessed for decision making. Okay, because warfarin will be contraindicated in his condition. Okay, so
Okay.
I want to see him, examine him, and all of this. Uh, are you following me?
Yes, I'm following you.
And additionally, I can go with you at home and send some ambulance for help if you wish that, and it will be really a good idea.
Okay,
Does
that
it
would be
sound
really
good?
helpful. Yes, that would be really helpful.
Okay.
Uh,
And okay, you
yes.
have no problem in a home visit.
No, I have no problem. Thank you so
Okay.
much.
Okay, so we have been through your condition, and we refuse actually the prescription of some medications, and we will make a home visit. Anything else? Do you have any other concerns?
No, that's it. Thank you.
Thank you. I will arrange this visit immediately. Thank you.
Thank you so much.
Great. Perfect. You have done perfect as a carer.
You have done perfectly.
Okay, but you have to extend your angry you're fury. You have to be furious. Furious.
Okay.
We know how this. You have to be. I think you have no hypothyroidism, or to be
No,
okay.
but then
So
you're a
you have to
doctor,
be
right? So
strong.
how can I
No,
be
you
mean to
can
you?
be because angry patient, when you really with your family or your whatever, you will be angry. Okay,
Okay. Okay, I'll be angry. Fine.
uh, no problem. But me as a doctor, I emphasize the information. I sympathize, show
Okay.
sympathy with you, so it will be okay to show sympathy, emphasize, reassure the patient that his father or her father will be in good hands, and we are experienced team, but we need to make consultation. We
Okay.
examination is necessary. You have to exceed the bullets of information because you will have um, five complete 5 minutes. Okay,
Okay. So how many role play? How many cards are given to us?
you will be given two cards by two role plays. The speaking is like before OET. Okay, 2-0 is the same speaking as OET previous one until September.
So what
Okay.
is this? What is this OET 20?
Uh, okay. Before September, we examined the occupational English test. OET zero.
Okay.
There will be modification in reading and listening.
Oh.
Part C here. Part C here. Okay.
Okay. Okay.
Okay. We will do another one, but you will be this time. You will be
Doctor.
a doctor. Okay.
Okay, that's fine.
Okay. Next one. Okay. I'm the patient and you are the doctor. Okay. I by the way, you have finished the previous one on only only 4 minutes. Okay. So perfect
Okay. Okay.
because time will not be you will not be controlled by you. You have only 5 minutes. Okay.
Okay.
Okay. Let's start. We have 3 minutes to read. Okay. This is your rule and this is mine. No,
Okay.
this is mine and this is your rule. It
Okay.
okay. You are 40. Are you ready?
Yes. Should I start? Hi, can I start?
Yeah.
Hello? Yeah.
Hello.
Hi, hello. Good afternoon. I'm Dr. Nidhi. I'm the treating doctor for today. How can I help you?
Sorry?
Should I repeat?
Yeah.
Um, Good afternoon. I'm Dr. Nidhi. I'm the treating doctor for today. How can I help you?
Okay, actually, I'm just waiting the results of my fasting blood sugar.
Um, okay. If I heard correctly, what should I tell?
Okay, here your blood sugar test results, and you have blood glucose level of 7.6 millimole per liter. Okay,
Okay. Yeah.
so you will tell me the diabetes because the diagnosis of diabetes has been confirmed,
Okay.
and I will start to ask about the clarification for diabetes. What's
Okay,
diabetes?
fine.
Yeah.
Okay, fine. Um, so how much is your blood glucose?
No,
How
no,
much is no?
no. You are the doctor, and you provide the patient with the results. Okay.
Okay. So I see. So can I go like? So I see from the your blood glucose test report that the value. I mean that the blood glucose is 7.6. Is that correct?
Oh, oh,
No.
oh, I'm really sad. What's this is a sugar diabetes. Oh,
Uh,
I have diabetes, doctor.
don't don't worry. It's I will tell you everything about diabetes. No, sometimes you can get sugar diabetes even if you don't eat enough sugar. I'm here to help you, so no need to worry. So, do you know anything about diabetes?
I know the only the name of the sugar diabetes. Am I
Um, okay. So what should I tell?
okay? You will tell him uh, here you have to read this. Have you read this? Briefly explains the diabetes and the causes. Okay, you will tell him that diabetes meaning the high blood sugar level. Okay, and I can clarify further causes of diabetes. Okay,
Uh-huh.
because diabetes will be from the causes like obesity, hyperlipidemia, or high blood cholesterol, smoking. Even with age, you can be you can be diabetic. Okay, so even you don't eat sugar, there's no relation between eating sugar and getting diabetic. Okay, so this you have in from this explains the threshold. Okay, that
Mhm.
raised glucose values on two occasions because this is the second test for him. This is the second test for him.
Okay.
So we have raised the glucose values on two occasions. So we have done already. So we are confirming that the diabetes mellitus is our diagnosis. Okay, this confirmed by the WHO standards.
Okay.
Okay, and then he will say blah blah blah. Okay, you will say him, oh, I'm really sorry for hearing that. I really appreciate your concerns. You have to be strong. You have to be of a high pitched voice. You speak like a doctor. You are the leader of the conversation. You have to clarify. You have to show sympathy and emphasize your information. Okay, here
Okay.
here is written for the patient. Stress that you are not convinced with the diagnosis. Okay, but I'm not convinced with the diagnosis. According
Okay.
to WHO standards, we have two blood glucose level tests are confirming raising a raised blood glucose level. So
Okay.
you are in good hands. We are expert in diagnosis such diseases. So is that clear for you? Am I clear so far? Okay.
Okay.
Are you following me? Okay. Explain that early treatment and regular appointments for monitoring state like sugar, blood glucose, cholesterol level will help to prevent complications. Okay, what is these complications like blood vessel or heart complications, brain or feet problems, all of this, because you know the complications and the
So we
problems.
have to, we can, so we have to tell everything that's written on the card. Mm. Like, for example, we can use our own knowledge, or we just have to
Yeah,
be
yeah, you can.
limited to the card.
No, not limited at all. You are a doctor, you are free to speak. No, it
Oh,
is vice
okay.
versa. You have to paraphrase these words. WHO, it can be not standards, it can be guidelines, okay? Even guidelines or guidelines, okay? You have to paraphrase, you have to increase, add informations. He said, etc.
Okay.
Okay, and I'm sure of that, don't worry. Okay, demand more tests. He is not convinced. Okay, explain. Okay,
Mm.
I'm not convinced, doctor, really. I will not do that because I don't believe that this is the diagnosis. I'm really sad. Oh, I'm really, he is reluctant now. Okay, you have to show sympathy. Oh, I really appreciate your fears. But let me explain something for you, that we have WHO guidelines states that after two raised blood glucose level values, we are confirming we confirm diagnosis of diabetes. Okay, so we are sure, we are expert in diagnosing such diseases. This is the information. Then reassure him. So, sir, sympathy, information bullet, reassure him. But don't worry, as I said, as I have mentioned before, you are in good hands.
Okay.
And we are expert team in treating such disease. Okay,
Disease.
demand more
Okay.
tests. But doctor, I'm not convinced. I need more tests because this is like I don't eat sugar even. Is the interlocutor will be like this, because you will be reluctant more. Okay, we will do blood tests, but this will be on routine checkup visits. Okay, or routine follow-up visits, like he given here, sugar and the
Okay.
blood pressure and the cholesterol. Lastly, he will be reluctant with you more and recommend. What do you know? What do you want doctors to do? Sorry, doctor. We have to do dietary and lifestyle modifications. It will be a good idea to refer you to a
Refer to your
dietitian or a
dietitian.
diabetic or a diabetes educator. It will be excellent idea for us to do. Is that okay with you? Do you think you can do that? Whatever. Okay, convince him to commence the preventative measures. We have to But first of all, we have to follow the instructions. We have to take the protective, not preventative. Okay, try to paraphrase protective treatments, because as the results are valid and further tests are unnecessary. It's not important to do further tests. Okay, do you have any other concerns? Thank you. Goodbye. This is the end. Okay.
Okay. Thank you, Dr. Ina. Next
I want
question.
you to be perfect than this because your level was good in the first. I'm sure you are not concentrating these days. Okay, I don't know why, because your level in writing, you posted mini writing, was good in the first, but late. I am not convinced that this is Nidhi. Okay,
Okay.
okay. So I have
Yeah,
finished.
I think maybe I'm getting scared.
Okay, okay.
Not scared of
I will.
you. Maybe I'm scared of the exam.
You are scared of me? Oh,
No. I'm not scared of you. I'm scared for the exam, nothing else.
okay. You will be good in exam. Okay, I will. Okay, thank you. Goodbye.
Hello?